Hi again. Sorry for the delay on the Doppler updates. Who knew acquiring Doppler blood flow pressure measurements during and after COVID would be so difficult? But we got them, thanks to Eileen Salazar, our Doppler tech extraordinaire. So the first thing we did was find the blood flow pressure measurement on the superficial temporal artery on men in their 30s with a full head of hair. And the average blood flow pressure measurement is 90 centimeters per second. Now, the Doppler scans on bald men with the visual of the bald scalp on one side and the coinciding blood pressure measurement on the other side. As you can see, the blood flow pressure counts on bald men are far, far lower than the average of 90 centimeters. Now, for me, this is a aha moment where on one side of the glenoid fossa you have 90 centimeters of blood flow pressure, and on the anterior or the front portion of the superficial temporal artery you have 18 or 20 or very low blood flow pressure measurements in that less than 2-inch period. In these two videos and paper, Brian Dye, have brought forward evidence-based science that no one knew existed. I've shown you how this science works. I've also shown you the common link all men balding on the vertex of the head have, and I've showed you how to achieve that. I also provide protocol to dental offices so they can start treating their patients to avoid balding. Yes, I am saying balding is a dental problem that can be solved through dentistry. At this point, general dentistry and traditional orthodontics don't even realize this is the cause of the occlusal pathology that causes balding, sleep apnea, TMD, perforated meniscus, artificial aneurysm, Bell's palsy, and giant cell syndrome, largely because dentistry has ignored this area of the mouth. To top it off, the retraction style dentistry commonly used just makes things worse. The only way dentistry will work is if it follows the biological growth pattern of humans. What is needed is a modern day style of mewing orthodontics where no teeth are retracted or distalized, and bicuspids and wisdom teeth are not extracted. Hair grow products. Successful hair grow products all contain histamine. That's because when histamine is taken or applied, it broadens arteries, allowing more blood to flow in a constricted artery. The problem is, eventually, left untreated, the condyle will completely block the superficial temporal artery, and no amount of hair grow product will work at this point, and the mandible is still dislocated. The new language of balding, DHT, beta inhibitors, and so on. You know how they discovered DHT was by extracting fluid from the scalp of a bald man. And they analyzed what they found and they named it DHT. My understanding of what's really going on is the hair is falling out because the superficial temporal artery is blocked, stranding unoxygenated, decomposing blood, artery, vein, and hair follicle under the skin. Now, the white blood cells arrive, ridding the body of all these decomposing contaminants, and further go on to patrol the scalp, which it could never do before because the vertex follicle pad / organ was in the way. What they found and called DHT was just a heightened awareness of white blood cells. And testosterone has nothing to do with balding. There's plenty of documented cases of castrated men with full heads of hair. And genetics, if genetics had anything to do with balding, we're all genetically exposed. We all have hair to lose at some point. We all have lips and teeth and muscle to provide the hair loss service. Why is balding most visible around 30? While young adults 13 to 21 lose the last of their baby teeth on the upper and lower arches called premolars that are replaced by your permanent bicuspids. The bicuspids come in or erupt directly behind your front 6 teeth, upper and lower. But sometimes the timing of the replacement teeth is delayed, allowing the lips and their 200 grams of pressure to do what they do, causing the maxilla to be deficient, forcing the lower teeth and mandible backward. Now, when the replacement teeth fully erupt, they do not fit together correctly and take some time to wear into a backward or distalized location, all around the age of 30, where the pathology of balding increases tenfold every year. Okay, having said all that I have, Brian Dye, declare I have found what causes balding. I have the evidence-based science on how to eliminate it. I've shown you how the superficial temporal artery is blocked. I've shown you how the vertex follicle pad / organ dies. Now, I know my science is new and it's going to take some time to learn. And it also comes in 50 years after the genetic discovery, which has gone nowhere like the other Band-Aid fixes of balding in the past. Rest assured, this is not a Band-Aid fix, this is the cure. And I know there's been money and education pumped into this for the last 50 years. It's going to take a long time to eliminate that, but the truth prevails. And all I can hope is that anyone concerned with balding gets the opportunity to view this evidence-based science, and then they can make their own decisions a little easier.